Hello and welcome to today's webinar. I am Professor Bettina Borisch, the CEO of the World Federation of Public Health Association, and it's my great pleasure to be your moderator of today's webinar. The title of today's webinar is Public Health Policy to Advance Equity for Women, Children and Youth. Today's webinar is hosted by the Women, Children and Youth Working Group of the World Federation. In 2024, 1 in 4 countries report backlash on women's rights. Women's and girls' rights are facing unprecedented growing threats worldwide, from higher levels of discrimination to weaker legal protections and less funding for programs and institutions. So I think we are in a very timely topic here. And in around a month, we will have a second webinar on Tuesday, 25th November. The second webinar will look at public health advocacy to advance equity for women, children and youth. And we are glad to have our World Federation past president, Michael Moore, an expert on advocacy, who will provide training in advocacy skills. Today we have 2 speakers. First, Dr. Flavia Bustreo, and followed by Dr. Fiona Robards. So first, I'd like to welcome our very special guest speaker, Dr. Flavia Bustreo. If you haven't met her, you have to. She is the Italian energy behind the Italian energy behind the issue. She is a leading physician, a public health professional advocate for the health and human rights of women, children, adolescents, and the elderly, and is known for taking action on social and environmental determinants of health. Currently, she is co-chair of the Lancet Commission on Violence Against Women and Children and chair of the UN University International Institute for Global Health. Dr. Bustreo is also the vice chair of the Fondation Botmar here in Geneva and a member of the distinguished group GWL Voices. She is a member of several other boards and advises governmental and non-governmental entities, such as Global Future Council on Health, Healthcare, and the World Economic Forum. Dr. Bustreo was Assistant Director General for Family, Women's and Children's Health at the WHO from 2010 to 2017, and also served as vice chair of the board of Gavi, the Vaccine Alliance, from 2015 to 2017. At WHO, she led the organization's work in reproductive, maternal, child, and adolescent health, climate change, aging, vaccinations, health and human rights, health and gender equity. Previously, she was the executive director of PMNCH, which stands for Partnership for Maternal, Newborn and Child Health, and served in a variety of roles at WHO and UNICEF. Dr. Bustreo also worked for 7 years at the World Bank, where she's managing the WHO World Bank partnership concerning child health. This included formulating policy, influencing the allocations, we talk about money, of resources at country level through lending instruments and producing joint publications. And if we were at publications, sure, Dr. Bustreo is the author of more than 100 peer-reviewed articles and book chapters in leading journals such as The Lancet, the British Medical Journal, and she is a frequent commentator in the media on public health issues and international issues concerning women and children. For her scholarly work on the right to health, she received honorary degrees from Essex University. She has been keynote speaker at several academic conferences. To name just a few, Harvard, Cambridge, Università La Sapienza, Roma, Padua, and so forth. You understand that we are very, very blessed to have Dr. Bustreo today here with us. And Flavia, the floor is yours now. We're looking forward to hear you.
Thank you. Thank you so much, Professor Bettina and Dr. Fiona Robards. It's really a delight to be with you, with the Public Health Association. And I'm especially pleased that the Public Health Association has chosen to have a webinar, and I understand even another one this year that is on the topic of women, children, and adolescents' health and rights. As you understood from the presentation, this has been at the center of my work for many, many years. And every time that I'm introduced to this, Bettina, I don't know if it is the same for you, when the speaker go on for a long time introducing you, you're just reminded you that you are aging, because there are so many things that you haven't done, and you can only have done that if you have a certain activity behind you, so age. But for me, really, when talking about women, children, and adolescents and public health, the important word to associate is equity. And in these 15 minutes that we have together, I'll try to elaborate why equity is a central word for our work, and hope to convince you in case you're not convinced, and hope to also elicit questions and issues for discussion and for follow-up of this conversation. If we can get the first slide, please. So why do we need an equity approach, and why do we have to start our conversation with equity? Number one, healthcare and health is a fundamental human rights. And we know, we have data and evidence that the healthy future is only possible if people have access to healthcare, and also, as I will elaborate, they are protected from what we call some determinants of health. But this is central to enabling the fulfillment of their right to health and well-being potential. Now, when we look at a particular, you all work in public health, so like me, you all have the concern for the entire population in your country, in your city, in your community, wherever you serve as public health officer. But I like to place to your mind that when you do that, you always have to look at the population of women, children, and adolescents with a special eye. And not just because they are your friends, your family members, or your sons and daughters, but because they are disproportionately affected in public health context. And we have seen, and we have data and analysis that, for example, when public health crisis, pandemic struck, like COVID, but also I can give examples of Ebola in the context of the 3 countries that were affected in Africa, it resulted in increased maternal mortality and child mortality, not even in the immediate, but in the post-crisis. Then also we have increasing evidence that climate change is impacting profoundly the health of women, children, and adolescents, and conflict are a special concern because the displacement that is attached, and increasingly we see that unfortunately conflict affects civilians, and those civilians, like we see in, for example, in the situation of Gaza, the majority of the deaths that we see in Gaza are women and children. So this is why we need an equity approach for public health. And I don't want to start the talk with doom and gloom, as they say, in this particular year, because if we look at the history in the last 25 years, we actually see that women and children and adolescent health outcome have improved over those years. For example, we have moved from around 15 million deaths in children under 5 in 1990 to less than 5 million. So the improvement has been significant. But the point to remember is that it's not for all people and not in all places. The next. So when we start about public health conversation, often the temptation, and even in the work at the World Health Organization, we often start with the healthcare services and what characteristics the healthcare services have to have, and what kind of accessibility, what kind of quality, but I like to start to remind ourselves that in fact, health also for women, children, and adolescents is a production of functions that is affected by what we call the social determinants, the environmental determinants. More and more, we also have the commercial determinants of health. I will not touch on that today, but we have to look at the production of health first. And among the social determinants of health, I've only listed here the classic, the economic status, and that is some of the reasons why women are often more at risk, because they are less paid, they are engaged in the informal economy where wages are more unstable. Very often, they do not have access to proper insurance mechanisms, so that also impedes their access to healthcare. Education is strongly associated with life expectancy, morbidity, and health behaviors. And unfortunately, just to be reminded that even with the improvement that I have discussed, there are still 16% of children and youth that are not attending school. And for us in public health, this has to be a concern. Then there is the issue of violence. And violence is an important determinant of health because it's, we have data very clear for the last 2 decades that, in fact, when a child is brought up in an environment that is violent, even if he or she just witnessed violence, there are significant consequences for the life course of that individual. If he is a boy, he's more likely to become a perpetrator of violence. If he is a girl, he's more likely to become a victim of violence. But for us in public health, also to import the important things, and we have published this data this year in Nature Medicine, and they have confirmed that the impact of violence on the health outcome of women and children are profound. And they are profound on physical health, but also profound on mental health. They lead to depression, anxiety, substance abuse, and, for example, disorders of feeding. So the profound impact of violence cannot be underestimated. And in many countries, one thing that I like to leave with the public health professional, it is important to remember, in many countries, unfortunately, we do not have the data that enables us to really understand this. For example, in Italy, my own country, my beloved country, despite the recommendation of the Committee on the Rights of the Child, we still do not have national survey on the prevalence of violence against children. And the data we have are collected by an NGO, Terre des Hommes, that is doing an amazing job at least providing some measurement. The next slide, please. The environmental determinants are also very, very important for health of women, children, and adolescents. And in fact, just before we started the meeting, we had a conversation with Dr. Fiona Robards, and I understand that there is maybe the plan for next year to have a special webinar where we will zoom deeply into these environmental determinants of health for women, children, and adolescents. Because the data we have is that, again, this population we are focusing on today is disproportionately affected by climate change. For example, the temperature increases, they have a significant impact, for example, during pregnancy, at the time of delivery. They have significant consequences on the health of the newborn baby. And all of that is, in the last 10 years, we have data that keep accumulating, and it would be good to share them and have really a significant discussion around those. Also, air pollution, both household air pollution and outside air pollution, they impact more directly, particularly women. especially because in low and middle income countries, around 3 billion people still cook using the solid fuels, the wood, the charcoal, coal, and dung. And this creates indoor air pollution that women and the children that are typically responsible for household chores are much more exposed to. And of course, water and sanitation are also an important environmental determinants of health, and the safety and the inequality in access to safe drinking water, to sanitation and hygiene practices is particularly important for menstruating girls and women. Next slide, please. So coming to really the aspect that we want to discuss today. So what does equity in public health for women, children, and adolescents look like? What kind of policy responses should country have? And here you have the umbrella that maybe many of you will have seen in WHO. We have used and developed that symbol of umbrella that is the universal health coverage that protects us from the rain. But it's important to say that the strong policy framework that countries should have, they should address access to healthcare services and strengthen the system through universal health coverage, but they should also address the social and environmental determinants. And therefore, the response must be multi-sectoral. As public health, we often know that that's the case, whether it's a response to food, whether it's a nutrition crisis, that's also very, very important for health of women and children. This has to be multi-sectoral. And the health sector also has its important role to play, because currently, unfortunately, the data from WHO are that 4.5 billion people were not fully covered by essential health services in their countries. And we have to remember that the universal health coverage, and Bettina, you have led on this point, is a package that has to cover the full continuum of health services: health promotion, prevention, the importance of, for example, vaccination for health of children, the treatment, the rehabilitation, and the palliative care when that is needed, and unfortunately is very often needed. And here, one particular point that I would like to stress, and that today is poignant. You started that, Bettina. It's for women, especially, access to sexual and reproductive health services are an integral element of universal health coverage. And unfortunately, in many countries, these access and these rights are significantly attacked. And we really need to have the responses, articulate the responses, and articulate the protection for access to family planning services, to comprehensive sexual education for adolescents, to the care during pregnancy, at the time of delivery and the post-delivery, including the protection of mental health and, for example, care for women if they have postpartum depression. That is often one thing that is neglected. And also this across the life course. So not just for women that are in the reproductive period of their life, but also what we published 10 years ago in the special issue of the WHO Bulletin, which is women health beyond reproduction, and all the issues that are associated to that beyond reproduction, the stigma and the reduction of attention to menopause, and all the issues that we have in non-communicable diseases, from cancer, breast cancer, cervical cancers, and other cancers, as well as all the other non-communicable diseases that affect women, but they affect them in different ways with different presentation, and often they are undertreated and under-recognized. The next slide, please. One point that is very connected, and that for public health officials, I think is important that we touch upon, is although women are a particular population and we have elaborated on the kind of vulnerability and risks that they have to their health outcomes, and although now we are in the presence of what we call often a feminized health workforce, which is that 70% of health-related jobs are held by women globally, and for certain positions like nursing, that is higher, and for midwifery position is 90%. Although this is a situation, we still have a scenario in many countries, and certainly in global health, where the leadership of the health sector is prevalently male. And on this point, we actually not seeing much improvement. And with the current crisis that Bettina mentioned at the beginning, we are risking to see a reversal of it. So if we look at the next slide, what we did with this group that is called Global Women Leader Voices, we did an analysis of the Global Health Multilateral Organization, WHO, the WHO Regional Office, the World Bank, the Global Financing Facility, the Gavi, the Global Fund. And you can see that the darker orange are the year that since the foundation of these institutions, the institutions was led by a woman. So if you look over the last 80 years, you see that in the last 20, 30 years, we are progressively changing, but some institutions have never been led by a woman, like, for example, the regional office of WHO of the Western Pacific, and, for example, the Global Fund. So the funding institutions tend to be led by men. Next slide. One other aspect that I really wanted to share with the group, which is when we talk about women, children, and adolescents, often historically, adolescents' health and well-being has been, I wouldn't say neglected, but has been considered less a priority, because until maybe 10, 15 years ago, most of us working in public health considered that the adolescent age and the adolescent years were years where people were healthy, and there was not high mortality and there wasn't high morbidity, and therefore we never really spotlighted that. But in the last 10, 15 years, we have actually seen that unfortunately this is not the case. And these are data, I'd like to bring your attention to the Lancet Commission that was led very, very bravely. Now this is already the second Lancet Commission on adolescent health and well-being. And this has highlighted some of the issues that pertain to adolescent health and well-being, especially the fact that the cohort of adolescents today are the first group that have lived in the shadow of climate change crisis. And also, if you go to the next slide, that there is a particular issue of mental health for adolescents. Actually, Bettina, I don't remember if you were present when they presented the Global Burden of Disease study just 2 weeks ago in Berlin. And this is one of the issues that the Global Burden of Disease highlighted. That was the increase over time of mental health issues for adolescents. And the Lancet Commission highlighted certain themes, that there is still a stigma around this issue. There is a lack of data in countries. There is also tension between defining mental health issue and the fragmenting stakeholder community. And of course, the overall investments in addressing adolescent health and well-being, as you see in these slides, remain extremely low. And so as we in public health advocate for resources, one key aspect that I like to stress is we need to look at the investments in adolescent health, because it provides triple returns on investments. Is an investment for health of adolescents themselves, is an investment because we prevent some of the risk factors that have their onset in adolescence, for example, the tobacco use, for example, the eating disorders, for example, mental health conditions, severe mental health conditions. More than 50% of them have their onset in adolescence. But also is an investment on the health of the next generation, because as the adolescents become the future parents, if they are healthy, they're better able to care for the next generation. Next slide, please. And here, one final point. How am I doing with time? I think I'm still okay, right?
Yes, perfect.
Good. One final point that I wanted to make, which is important when we discuss about equity in public health. Until now, my presentation has focused really on what I would define real life. But increasingly, all of us, especially the young people and the adolescents, we also have a virtual life. And that virtual life is fraught with risks and risk factors that I think as public health physicians, we really need to be well aware and also prepared to combat. So the cyberspace is currently a space that is emerging as where gender inequality, that is at the basis of some of the reasons why we see worse health for women, this cyberspace perpetuates gender stereotypes and even including violence against women and children in a new, rapidly evolving with speed and reproducibility that even violence in real life does not have. And there is an incredible research coming out of UK and Canada that, for example, the material that is used for sexual harassment and sexual violence online not only harms a survivor in a very profound manner, but also it is long-lasting because these images continue to appear over the life course of these young women that were following the study. So this space is being used in new ways to harm women and children's health. Next. So what does equity in public health for women, children, and youth look like? I like to add that we now need to really have a special attention to digital space, artificial intelligence, and data, because on one end, they can be a powerful tool to ensure health and well-being of women and children through the provision of digital health services and the digital transition. They can help us reach more marginalized community in different ways. But these spaces are running on data that have a significant bias. And for example, here is just one study quoted where they have seen that the systems across different industries, they have shown gender bias, gender and racial bias, and also they bombard users, particularly young men, with misogynistic context. So we really need to look at those aspects and be aware in our society where we operate and we have our profession. I believe this is my last slide. I do not have a concluding slide, but I just like to thank you for your attention and look forward to your questions and reflection. And just I hope I have managed to convince you that when we talk about equity in public health for women, children, and adolescents, we really need to have a public health approach that starts from the determinants of health, looks at the healthcare services and system, and also pretty much look at the important virtual reality that we all live in. Thank you so much, Bettina, and thank you so much, Fiona. It's a pleasure really to be with you.
Our pleasure. Thank you so much, Flavia. Thank you for reminding us of why public health policy is important, but also to talk about the digital determinants and also perhaps the dark net in the cyberspace, where a lot is going on against women, but also the topic of crisis and women and children. I think you made the grand tour, and thank you so much. Just for those who follow us, please put your questions in the Q&A section. after the second talk, we will have a Q&A part. And I said second part, so that's now my great pleasure to introduce the co-chair of the Women, Children and Youth Working Group, Dr. Fiona Robards. I may say that during her sabbatical that she had in Geneva, I really started to admire her excellent work and her work on the field. It was a pleasure, Fiona, and continues to be one. Fiona has extensive experience in youth health policy development as a researcher, youth health service manager, and psychologist. Dr. Fiona Robards is a senior lecturer and senior research fellow in child and adolescent health at the University of Sydney, Faculty of Medicine and Health, where she leads research projects to advocate for the health and rights of children and young people. She is co-chair of the World Federation's working group Women, Children and Youth. And now I'm very happy to see and invite Fiona to present global public health policies for women, children, and youth. Fiona, the floor is yours.
Thank you so much, Bettina, for that really warm introduction. And thank you, Flavia, for your wonderful presentation. It really highlights the need for advocacy for women, children, and young people globally. So today I'll be sharing some research that was done by our working group, the Women, Children and Youth Working Group of the World Federation. And this is the publication which you can access via the QR code if you want to have a read of it. And I'd also like to acknowledge the team who worked on this research, which includes Hayley Myers and Adjunct Professor Deborah Klein-Walker, who's also the co-chair of the Women, Children and Youth Working Group. So this research explored global public health association policies related to women, children and youth, and it was published in the Journal of Public Health Policy. And I'm sure you're all aware that the World Federation is the worldwide professional society representing and serving the broad field of public health. But you may not be aware that it represents over 5 million public health professionals worldwide, which is pretty amazing, really. So the World Federation and its members all influence international health policy by developing and implementing policy resolutions and position statements. And the Women, Children and Youth Working Group has been very much focusing on this over the last few years and currently, and we've been developing policy statements to advocate for the needs of these groups. So let's look at public health associations. They also have a really important role. We know that women, children and young people from ethnic minorities and those living in remote rural settings and in poor urban areas are among the most marginalised population groups. So advocacy for women, children and youth is a really high priority to ensure the well-being of future populations. And public health associations, as well as regional public health associations, they have really a very important role to advocate to improve the health of communities and to reduce inequality. So they can advance the health of women, children and young people and to promote achievement of the Sustainable Development Goals. So in this research study, which I want to share with you, what we're aiming to do is to identify all the policies that have been published by public health associations globally on topics that related to women, children or youth health. So first, we got a list of all the countries around the globe from the World Health Organization website, and we also consulted the World Federation website. If the country wasn't listed there, then we did a Google search. So we noted if each country had a public health association, if they're a member of the World Federation, if they had a working group that related to women, children and youth, and if they'd published any policies. And we took note of some of the topics. So what do we find? Well, we found that of the 203 countries globally, there's 130 public health associations, which is pretty amazing that there's that many associations globally. And of those 130 public health associations, the vast majority are members of the World Federation. With the majority, so 64% also have their own website, and others also had social media sites. We found that 24% also had a policy mechanism, and this was evidenced by having policies published on their website. And in total, we found there were 60 policies published relating to women, children and youth. They were all published by 8 public health associations and 1 regional public health associations. So this diagram shows the policies. So on the left, we have the countries that have a women, children and youth working group. And on the right, we have the countries that have produced women, children and youth policies. And you can see there's an overlap in the middle. So on the left-hand side, we've got 6 countries listed there. So they had a working group relating to women, children and youth, but they hadn't published any public policies. Then on the right, the far right, you've got countries that even though they didn't have a working group, they'd managed to produce some policies relating to women, children and youth. And in the middle, they had both. They had a working group and they had policies. So that was an interesting exploration there. And the next slide is really the details. These are the countries that had produced policies relating to women, children and youth, the 8 countries as well as the regional association. And that regional association is WFPHA. So just checking where I'm up to. So you'll see here that Australia and the United States really stands out as having developed quite a few policies. And in fact, there's of the 60 policies published globally, Australia and the United States actually make up 63% of the policies published. Okay, there's a few limitations to this study because we only included public health associations with websites so that they were able to actually publish the policies. But we're aware that some public health associations also have a web presence via social media instead of a website. But that probably really limits whether they can publish policies and position statements. And we also used Google Translate whenever the websites weren't in English. So in conclusion, we found really there's very few countries who've developed public health policies advocating for the health of women, children and young people. And as I said before, it's only 8 countries and 1 regional association that's developed country policies for these groups. So we'd really like to call on public health associations globally to consider expanding their focus in their advocacy for women, children and youth. And we'd really encourage you to develop policy statements in particular and do other advocacy activities. And as you probably noticed before, having a coordination group that's dedicated towards women, children and youth is not necessary for creating policies, but it could enable the development, so it could be helpful. Okay, so the World Federation, we have quite a few policies currently developed. which are listed here. And we also have they're all published and on the website. We also have 3 policies that are currently under development. And the ones we're currently working on include preconception, pregnancy, and youth health. So there's quite a few opportunities for collaboration. I encourage you to get all involved through your public health associations, because advocacy is really needed through these groups. And the World Federation Women, Children, Youth Working Group also provides leadership through developing policies for the World Federation on these topics. We invite members of public health associations globally to join our working group if you'd like to contribute to policy development and review, as well as our other activities. So this webinar is part of a 2-part series, as you heard before, and this is the promo for the second webinar in this series, which will be Michael Moore. Professor Michael Moore will be our special guest speaker, and it'll be focusing on developing advocacy skills. And you can look at the World Federation social media, especially LinkedIn, to get the details, or you can scan that QR code to register for the webinar. Of course, there's also the World Congress coming up, and abstracts are currently open. So look forward to meeting you at that big, important meeting. The Women, Children and Youth Working Group's planning a workshop to look at policy issues for women, children and youth. And we're planning to have presentations as well as small group discussions. We particularly want to invite members of public health associations to come and join in to meet us and be part of the discussions. So thank you. There's a few references and also my contact details if you'd like to get in touch. Thank you. I'll stop slide sharing.
Thank you, Fiona. Thank you very much. I know this work. I have followed when it was going on, and it's very close working with the World Federation. Thank you for that. And yes, I think we already have, and that's very good sign, Q&As, and especially the first one seems to come from a young professional. I'm putting it up here to you. Sanes Bordbar from Iran asks, in all the issues mentioned, especially right of women and children during disasters, what can be the role of youth and what can we do to help more? Who wants to step in? Flavia?
Yeah, thank you. Thank you so much first for that question, which is very important. And as I mentioned in my presentation, unfortunately, during conflict, disaster, climate disaster, women, children, and young people are affected by them. And I think the origin of this question is that historically, traditionally, there has been an attitude towards this population that has been in the humanitarian domain, especially, that has been of providing what we say humanitarian assistance. And already the word has a certain connotation, which means that you have to assist this population, but they do not have resilience and they do not have agency. And in fact, I personally believe, and I really like the question for that reason, that especially women and young people, they have a lot of resilience. And some of the organizing that we have seen in the climate change domain, in the response to humanitarian situation, in the response to pandemic crisis, they have actually come from women and from young people themselves. So I think what can be done more, you ask, I would say first thing is recognize that agency that the population has and that ability to cope with disaster, with flooding, and also learn from what what are the protective mechanisms that many of them have in place? For example, for young people, the connectivity between them and the ability to communicate among them is an important resilience mechanism, because you can signal danger, you can signal to the authority. So pay attention to that resilience, collaborate and enhance it. And also, I think for me, I added in my slides, and maybe I didn't stress that an important element is when dealing with policy that concerns youth, especially, their participation in defining the policy is crucial. There is one motto that I like to leave you to for the answer that I have learned working with a lot of young people around the world is nothing about me without me. And this is, there is a strong awareness that unfortunately policy often are written by elderly professionals, and they do not take into consideration the inputs of young people. So participation and empowering the participation is a key thing that we can do.
Thank you, Flavia, and thank you for talking about the fact that women, children, and young adults are not victims, but have a very active role to play. And thank you also for this question. And as you already have shown in your slides, we say health is produced by women and directed by men. And this is probably something that also goes on in and during disaster and crisis situations. I do have a second question that is, sorry, Flavia, directed exactly to you. It comes from Shahrin Maskey. Dr. Flavia Bustreo, during your tenure at WHO, you championed the global strategy for women's, children's, and adolescents' health. In Nepal, despite progress in maternal mortality, adolescent girls still face a 40% unmet need for contraception, and suicide remains the top cause of death among girls aged 15 to 19. Given your experience, what is one bold policy or financing reform you would prioritize if you were advising Nepal's Ministry of Health today to close these equity gaps for adolescents, and how can partners like PMNCH support its rapid implementation? That is you, Flavia. Now you have a second talk.
First, I thank you so much for the question, because obviously this colleague is been working on this field, is been following for a while. So
I can tell you it is an MPH scholar from Nepal.
From Nepal, that's wonderful. So first of all, what I like to say is, it is true that I've championed the global strategy for women, children, and adolescent health. And we worked with the United Nations Secretary General and with the different United Nations agencies. And one thing that is unfortunate during this current time, and you alluded to it, Bettina, is that this multilateral system is in a profound crisis because of funding cuts, because of some crisis of legitimacy that is being questioned, because of profound movement of nationalism, where countries are like deciding for themselves, by themselves, without wanting to engage with others. So one of the mechanisms that we always had available, for example, for advising Nepal, is currently not available because of the instability within the country, and also because of the diminished strength of these multilateral agencies that should work hand in hand with the country and provide that advice on a regular basis. So when it comes to adolescent pregnancy, one key element that it is very, very important for countries like Nepal is looking again not only at the public health mechanism and the health services, but also at the broad determinants. Child marriage. This is an important phenomenon that is unfortunately occurring. So it's not even that this pregnancy are occurring outside the marriage. They are occurring inside the marriage because of child marriage. And despite the fact that the legislation prevents that, but we need to look at the implementation of that legislation and ensure that you don't have girls that become brides before the time, because we know all the risks of adolescent pregnancy. Then there is the issue of access to comprehensive sexuality education, which enable the agency of young girls to actually make informed decisions about pregnancy and be protected from pregnancy if it is not wanted. And finally, there is an issue of access to contraception. That is a mechanism that, of course, prevents unwanted pregnancy. All of these parts that I have, especially pregnancy, sexuality education, and access to contraception, they are very, very much under attack at the moment. If you look at some documents the multilateral organizations are discussing, agreeing to negotiation, it was being, cut out. And I really appeal to the World Federation and Public Association to be steward for the package of universal coverage, but we have to be steward for making sure politically there is no deletion of these services. Sorry, it's the best I can do in a lot, Bettina.
Yeah. Thank you so much. And I see another question coming in from our first colleague from Iran. And I think that is something that goes to the heart of all women, because Sanis is asking, I also had one question. In some countries, rights of women are affected, but the authorities of there are not in favor of changing or helping. How can we help those women who we can't reach, for example, in Afghanistan? Difficult. I'm heartbroken when I look at the situation of women in Afghanistan. But what would you say? I mean, we are all in this situation.
Would you want me to comment, Bettina?
Wants to take up. I'll go to Fiona right away. She can already be prepared.
I think that this is a good question for you, Bettina, with your interest in women and advocacy for women's rights.
Yeah. Well, first of all, as I said, it goes to my heart. And I think it starts with the fact that women have to have a position. If we look at SDG 5 and its implementation, gender equity, all countries come under scrutiny, even the Scandinavian countries where we always say, oh, they're far ahead. We have to ask where from comes this anger and this aggression against women and girls. What are the reasons that men in some places, not all men, but always men, we know those now, tend to try to extinct the voices of women or even get them away? If we could answer the question, what is the problem of men with women? I think we could have better policies, because what happens in Afghanistan is just a disaster. But the question is, what's not okay with the men's brains there? What is their problem? As we say, 50% of over 50% of the world's population are women, and the other half are their children. So what's wrong with these men who all have a mother, and why, and who put them up to try to, in some places, kill women? And who are behind the people in the darknet? What are the political forces that create toxic masculinity now, and movements like incel? I think we have to look at the men's side and the mental health. And there is a serious problem if men health and women's is looked at, I think. And that's a very basic thing, because the question of our colleague is, what can we do directly? Directly, I would say, help every women's voice from Afghanistan. I know there are private online universities, help them get access, help them get with the possibilities we have in digital era to exchange with others, so they don't feel alone, that they know we all women are worldwide with them. I think this is my spontaneous reaction to that. Yeah, but otherwise, Fiona, your reaction.
Oh, I agree with what you say. It's really important to enable the voices of those women in whatever way we can, and social media is a potential opportunity for women to have a voice. Yeah. I noticed Flavia disappeared and now she's back
Flavia
again.
disappeared. I just wondered if she has an idea about especially women in Afghanistan and similar countries, but I think she disappeared for a while. So I hope that the answers to Sanis and also Sashim have been sufficient, a little bit of help, especially for the situation in Nepal. And I think at the very first question, I wanted to have you come in, Fiona. What can young people do themselves? You are the expert of young adolescents. What can they do themselves?
Well, I agree with Flavia's points earlier that it's really important that we involve young people's voices, on multiple levels, not only, in having a say about their own healthcare, but in how we design services and how we design policies. And if we involve young people with their energy and their often sort of big picture, idealistic sort of thinking, we can come up with new solutions and harness young people's passion for creating new and better and different societies. So it's really important to have young people involved. And I agree with Flavia's point too about the opportunities of digital environments for connecting young people and harnessing their ideas as well.
Yeah.
Yeah.
Thank you. And at this point, I think I would like to quickly mention that we have a working group, Young World Federation. For those who are online, they can join, and there is a lot of interaction. I know your working group, Fiona, has already interacted with the Young WFPHA, and I would invite all those online who feel young and who feel belonging to World Federation younger professionals to join and try to work on the issues that we also have mentioned and that were in the questions. I think we are coming to the end of the hour. I must say, I don't know what you feel, but this was very rich. I would like to thank both Flavia and you, Fiona, you especially for preparing so nicely the webinar, Flavia for your important input, and all those who followed us, thank you for being with us. The webinar is recorded and you can come back to it if you want. If there are other questions, don't hesitate to come back to us at our website at our info@worldfederation.org. And don't forget, we have a World Congress next year, September, Cape Town. Thank you for everyone. Thank you so much, and hope to see you in person, all of you. Bye-bye.